I think it's important for people to understand that atrial fibrillation requires a commitment for the first a little while to be patient with their doctors and their nurses. It can take a while to get things settled. So with medication to slow the heart rate down can affect some people individually, but more than others, and it may take a while to find the right dose. If you take warfarin, it might take us a number of weeks to find the right dose for you, because we've got no way of knowing what dose we're going to need you to be on prior to commencing you on the medication. I've got some patients who need 15 milligrams. I've got some who need 1, and there's really no way of knowing that until you start taking it. And I think it can be quite frustrating. I think at the start, having regular blood tests and taking medication that actually makes you feel worse in the case of the heart rate, and it really requires people to keep talking with their doctors and nurses in their general practice, to keep in touch, to tell people what's happening, so they can be but reassured that everything is going right, that we might not need to change their medication. It's not as easy as just taking an antibiotic for a throat infection. It's a process to get people on the right medication. I think people who take any medication, I think, need to understand what they're taking, and they need to understand why they're taking it, and they need to know what they need to look out for in terms of side effects, and that's a general kind of rule for any medication, I think. For anticoagulants in particular, it's important to not miss medication, because it can affect that clot formation inside the heart that we talked about. So people need to develop a way of reminding them to take their medications. That might be a blister pack that they can get from their pharmacist. It might be an app on their phone that reminds them. It might be remembering to put the medication in the drawer, next to the cornflakes. I don't know, but people need to think of something that is their trigger to remind them to take their medication. The other thing is to be very aware of other medications, that be it over the counter or other medications that are prescribed by other doctors that might interfere with medication for atrial fibrillation. So it's always worth checking if you're buying something at the chemist, or if you get a prescription for a different condition, to make sure that people know that you're on medication for atrial fibrillation, and that this new medicine isn't going to interfere at all with what you're already taking.